Elizabeth Scala here from elizabethscala.com. Thank you so much for accessing these content videos where I have been going through the questions, comments, emails I receive from nurses reaching out to me, requesting support and looking for some guidance. So I have another question here from an email. It was sent to me from a nurse who says, I'm always looking for ways to promote civility among my fellow nurses. While I feel nurses are some of the most caring bunch around, we tend to treat each other poorly and be uncivil. Isn't that interesting? I have obviously heard this a lot on the internet, following some folks who are experts in nurse bullying, specifically Renee Thompson. Also others like Beth Boynton who talk about safe and effective communication with medical improv and other modalities. So it is interesting to me, this nurse points out, we are a caring bunch around, professionally as a nurse you think of a caring, compassionate person, and then at the same time we can treat each other poorly. I actually read somewhere, and I cannot remember, so I'm not going to cite the reference. I apologize for that. I try to always give credit where it's due. That when a group of people feel oppressed or pressured or underappreciated, that they lack control, that they as a group kind of feel suffocated, whether it be against a system, whether it be against the people sort of above them, their management or supervisors, whether it be just policy and a working environment overall, when there's some tension coming down on a collective group of people, because they cannot respond to that effectively or don't know how, they tend to lash out laterally to the people, that are their equals. So this phenomenon sounds similar to what we experience in nursing, because as nurses we often feel disempowered, we feel out of control, or we lack control in the workplaces. We feel as though we're told what to do and how to do it with different policies and procedures, regulatory, environmental things like that, financial pressures. So the natural thing then is to want to respond to this, but if you feel you cannot respond upward, you respond sideways to your colleagues and your peers and potentially treat each other poorly. Now, that being said, I guess the first step to any change is having that awareness. So the fact that I'm sharing with this information with you may help you notice if this is happening in your workplace. Now, once you have that awareness, what can you do about it? So there are, as I mentioned, colleagues of mine out there teaching methods, tools, sharing resources for empowerment and for safe and effective communication, for teaching ourselves to be assertive in the workplace. We had recently, a couple months ago, interviewed a nurse, Louise Jakubik, from the Mentoring Institute, and she has a conference in the fall on nurse mentoring, who shares solutions, mentor your colleagues. And what I would add to that is be a role model. So I shared a video several weeks back about how sometimes we can go against the grain or feel we're set apart or by ourselves when we're trying to do the right thing in amidst, maybe our colleagues are not doing what we're doing. We're kind of out to the side or feeling isolated. However, often when you're doing the right thing, you have to put yourself out on a limb. You have to go against the grain. You have to be that individual. So in addition to mentoring your colleagues, I also would suggest we find ways to be role models. So if there is something going on in your workplace, instead of submissing to that, or being quiet and acting like it's not happening, or whatever the case may be, joining in the negativity, gossip, that kind of thing. Be more of a role model of someone who is a positive person, has an opportunity-focused perspective, focuses on solutions, looks at challenges and obstacles with the grain of how can we learn from this. So always having that visionary mindset, propelling yourself forward and bringing your team along with you as you do. So I hope this was helpful. I feel like it was a bit abstract in concept, but I recognize that nurses who have experienced these conditions and situations probably understand what I'm talking about. If you don't, certainly feel free to visit elizabethscala.com, contact me, leave a comment on this video, tell me I'm out there, or if you have a question, a follow-up question, I'm certainly happy to help. So thanks for watching, and we will see you in the next video. Thank you.